Hello everyone. The topic for this QR code is the slavery hypertension hypothesis. The slavery hypertension hypothesis proposed that the higher prevalence of hypertension amongst African Americans is due to a genetic selective pressure to retain salt. The hypothesis is based on the observations of various methods of salt loss being the cause of death during the transatlantic slave trade, the thought of there being lower salt reserves in Africa, and a salt loss from sweating due to slave work conditions. This controversial topic has been debated among scientists and historians for years. Previous studies show some support for the hypothesis, with African Americans' blood pressure being more sensitive to salt and maintaining a higher intravenous salt load. There are also documented studies indicating a higher frequency of a genetic variant that leads to impaired sodium channels in African Americans associated with the position on the equator. However, many have argued that earlier evidence supporting the slavery hypertension hypothesis is from the West Indies and therefore less applicable to African Americans. Some genetic studies contradict others, with genotype frequencies being similar for West Africans. Other arguments against the hypothesis include salt sensitivity is not unique to a single race, the amount of salt loss is unlikely to lead to a rapid selective pressure, and that there is no way to prove that salt reserves in Africa were less than anywhere else in the world. With such conflicting evidence, the most plausible conclusion is that hypertension is a multifactorial disease. Throughout history, there has been a tendency to define race as a biological category rather than a social one, leading to diseases being attributed to race. This can impact medical practice in the form of race-based algorithms and treatments that introduce biases and perpetuate disparities. Given that hypertension is multifactorial, we must also look at the impacts of systemic racism, causing inequalities and leading to poverty, which can make an impact on what foods people can have access to, ability to afford medications, and being able to see a healthcare provider. If you would like to learn more about hypertension and race-based medicine, please take a look at the references, and consider watching the supplemental YouTube video featured in the QR code for further discussion. Thank you.